Latest update po sa DOH, number of new cases as of May 4 ay 5,683. Number of active cases ay 66,060. And total number of cases to date, simula nung nag-umpisa tayo, ay 1,067,892. Pero 984,210 ay nag-recover. Pero po, 17,000 po, 622 ang namatay sa COVID. So, punta na tayo sa diskusyon po natin, no? Dapat napaka-importante po na malaman nyo yung ibang aspeto ng COVID at dito si Dr. Aniceto dahil expert po siya sa area na to. Doktora, yung una ko pong tanong, ano ang kailangan gawin kung ang nakasama sa opisina o sa sakyan ay nag-positive sa COVID-19?
Okay, so pag meron kayong nakasama sa sasakyan, sa bahay, sa kwarto, sa opisina, sa bangko na positive for COVID, ang tawag po ngayon sa inyo, you've had contact with a person na may COVID. Ang next step po dyan is to evaluate ano yung level ng exposure mo. And before we can do that, kung okay lang din, I'd like to share some slides para overview na rin for the discussion. Kung paano ba nakakahawa ang COVID at kung paano natin pwedeng iwasan na ma-expose tayo sa mga taong may COVID. So, nakikita po ba ang aking slide?
Wala pa.
Wala pa. Yan. I need to... makahawa kahit from someone na hindi inuubo. So ito kung nakikita ninyo sana yung slide ko, kung may COVID ang isang tao at nagsasalita siya, nagdi-dispense siya ng mga droplets at saka mga maliliit na aerosolized particles na may contain infected material. And yung layo ng naaabot ng mga ito ay depende kung gaano kalaki yung particle na yon. Okay, so dito makikita natin if walang mask yung infected na tao, but you're wearing a mask, then your risk is also low. Now, if walang COVID and wala ka ding mask, then you are at maximum exposure. So kung yung COVID ay see my risk for getting the virus is also very minimal. So yung mask, ang pinaka-simple na dyan, wear a mask anywhere and everywhere so that you reduce the risk for airborne transmission. This, ano ang probability na makaka-transmit or nakakahawa ang isang tao? Kung wala siyang mask, wala ka ring mask, you have a 90% chance of getting the disease. Kung naman ay nakamask, nare-reduce yan to about 70%. Now, kung nakamask yung pasyente at wala kang mask, you will notice na ang transmission is low. So actually, wearing a mask is protecting others as well. And if you are both wearing a mask, you can see that the transmission is reduced to
Ganun rin ba sa ano?
the infection is less than 2%. Exposure mo, then your risk is moderate. Pag nakamask siya, automatically reduces to low risk. Mask kayo pareho, that's extremely low risk. That's halos no So ano dito? Less than 15 minutes. Okay, so yun yung pinaka kailangan lang nating tandaan. Wear a mask, keep your distance.
Salamat na Doc Eileen. So informative yan po sa atin na dapat po talagang mag-mask tayo. Hindi, kung pwede, kung lahat tayo nakamask, then yung mga COVID at saka yung papasahan niya ay pareho nakamask, then talagang bababa to almost nil, no? 1.5% na lang ang paglipat ng COVID, ang paghawa sa COVID, no? Pero siguro dahil may 1.5% pa rin, kaya importante rin ang social distancing, no? Diba? Kasi sigurado na talaga kung malayo ka dun sa mga tao, meron carrier dyan, mas bababa yung chances na makakuha ng COVID. So, isa pa po, kung bilang empleyado, kailangan bang ipaalam sa employer na nagkaroon ng exposure sa COVID-19?
Actually, depende yon sa kung anong category ang level of exposure mo. Kung low naman, nakamask siya, you kept the distance, then technically, no exposure ka. So ang advice pa ganon, kung wala ka ng symptoms and yung category ng exposure is low, then you wear your mask, you can continue to work, you monitor your symptoms, and pag nagkaroon ka ng symptoms, that's the time you get yourself checked and isolate. So kung medium risk, for example, may kasama sa bahay na nag-positive. Hindi mo alam before nag-positive na may COVID siya. Kasi we've been walking around inside your house, walang mask, walang protection, nothing. Then you are higher. Then yes, you have to isolate yourself. You have to report to your employer, I have a household member who's positive for COVID. I have a high-risk exposure. Mag-isolate po muna ako to make sure that I don't bring the virus into the office. So it all depends on the exposure after having a contact patient na may COVID.
Ano ba sintomas ng COVID-19? Dapat ba mag-alala na ako kung meron ako sipon, lagnat, ubo? Kasi kadalasan, no, common ang magkaroon ng ubo at sipon. Mag-iisip na kaagad tayo, COVID na ba ito? So ano pa ang ibang pwedeng sintomas ng COVID para malaman natin, para talaga makaiwas tayo kung may COVID na tayo?
Okay, share ko lang din po para mas madali kasing mag-answer with if there's a visual aid. So can you see this po? Yan. So remember, okay, before siya mag-show, remember that ang disease, but it also has some gastrointestinal symptoms. So any symptoms na referring to the lungs, ubo, hirap huminga, sipon, sore throat, hindi makaamoy, respiratory yan lahat. So suspect COVID. Lalo na kung may fever or nanlalamig. Okay? Pero hindi lahat ng may COVID may lagnat. Pero in the classic presentation, parang flu, may fever, may sore throat, masakit ang katawan, may ubo, may sipon. In some patients, nagtatai lang sila o nasusuka. Okay, so this severity ng mga symptoms na yan can be mild or it can be severe. And it can appear anytime between 2 days from the contact with someone who has COVID to as long as 2 weeks after your supposed contact or exposure to the virus. So depending on the severity or gaano ka-mild yung symptoms, pwede naman silang maalagaan sa bahay if you have a way of isolating yourself from the rest of the family. Pero meron tayong babantayan. Hindi pwedeng pipilitin mo na nasa bahay ka lang the whole time. Kung hirap ka ng huminga, kailangan magpadala ka na sa doktor. Kung meron ng masakit sa dibdib, or parang bumibigat yung paghinga mo, kailangan ka nang magpunta sa doktor. Kung napupunan ninyo na yung inaalagaan ninyo, parang wala sa sarili, o mali na yung pag-iisip, kailangan dalhin na sa doktor. Baka kulang na ang oxygen sa utak. Or, kala mo natutulog lang, ginigising mo, ayaw nang magising. Ay, padala na rin sa doktor. Or pag mayroong nakikita kayo na parang medyo hindi na pink yung kulay ng pasyente, medyo malala na yon. Okay? So as much as possible, kung mild lang naman yung symptoms, maaalagaan yan sa bahay. Nakakakain yung pasyente, nakakainom, pwedeng i-isolate, pwede sa bahay. But babantayan lang po ang paghinga at yung pagsakit sa dibdib or severe na panlalata na hindi na sila makakain. Yon, babantayan lang din po.
Tama na pag-usapan na natin ang home care program, no, kung may COVID-19. Sino-sino ba ang pwedeng ma-home care? Kung may COVID na, sino-sino lang ang pwedeng ma-home care? Para sino ang dapat nandun sa isolation facilities or sa hospitals?
Okay. So yung review lang muna natin kung how the virus is transmitted. 4 ways yan eh. From droplet spread, naghatching, umubo, nagsalita, so may droplet. Merong aerosolized, so yung mas maliliit, lilipad-lipad, and it will like travel in the whole room and remain suspended. Matagal siya dyan. Yung mga pag nag-landing sa ating mga cellphones, sa mga doorknobs, lahat, so that's direct contact. Hinawakan mo yung ilong mo, tapos you shook the hand of your friend or something, so that's direct contact. You handled a phone na nahawakan ng pasyente, that's indirect contact. So you can get the infection any of this. Kailangan, when you're taking care of a person at home, kailangan matandaan mo yung 4 ways na yon, and you have to prevent yourself. Pero before I answer kung sino lang ang pwede sa bahay, yung may mga mild symptoms lang. Yung may mga, yung walang nararamdaman pero COVID positive. So yung mas malala yung symptoms, kailangan nasa hospital sila. So yung mga mild symptomatic, may konting ubo, may konting sore throat, pwede pa sila sa quarantine facility. Yung totally walang nararamdaman, pwede sa bahay. Yung may hirap ng huminga or kailangan na ng oxygen, kailangan sa hospital. So to protect yourself, when you're taking care of someone at home, even inside your house, kailangan nakamask ka. That's to protect yourself. And yung patient na may COVID, i-mask mo din. Kasi para ma-droplet spread niya, hindi masyadong malayo ang aabutin ng mga infected particles. You have to maintain your distance from the person that you're caring for. Always wash your hands and always disinfect the surfaces around the patient or around your house. So kailangan medyo praning ka sa paglilinis ng mga bagay-bagay sa inyong bahay. And ito yung nakakalimutan, you keep your home well ventilated. Open a window, open the door, put in exhaust fans. If you can afford it, put exhaust fans. Medyo mahal pero an air purifier or a HEPA filter. Also, improve the quality of the air and remove infected particles from the house or the home where the patient is or where you're staying.
Yung patient dapat yan talaga nasa loob ng sarili niyang kwarto no, isolated. Tama yun, no?
Yes po. As possible, sarili po ang banyo. And as much as possible, hindi niya i-share yung banyo. Para tapos, syempre, magde-deliver lang po kayo ng pagkain niya outside the door and he just gets it. Okay, so this some tips lang. Kung ikaw mismo ang may sakit, clean your hands when clean home, avoid public areas. Konsyensya mo naman kung sasabihin mo na mild lang naman yung symptoms ko, pwede pa ako mag-grocery. Okay, hindi ho. Parang there's a social responsibility attached to being. You have to. Your room should be well ventilated, and even if you're alone, you always have to practice cough hygiene. Kasi para to prevent na malayo yung abutin ng iyong mga laway or mga aerosolized na infected particles. Tapos all other members of the household, ganun din. Always check your temperature and your symptoms every day. And avoid unnecessary exposure to the ill person.
Doc, napansin nyo, nasabi nyo yung aerosolized, no? Pag nag-atching kayo, yung mga maliliit na particles na yan, pwede mag-travel yan, no? At mahulog sa mga bagay-bagay. Would you know kung kunyari may nag-atching, napunta dyan sa tabi ng cellphone mo, would you know how long, kunyari may COVID yan, how long siya tumatagal sa mga bagay-bagay? Would you know that?
Well, they
Ano
have
dapat
an estimate, but it depends on the material. Like for example, yung mga foam, hindi porous, they'll stay longer. Pero yung mga upholstered, they'll stay longer on upholstered furniture, yung mga porous. But the estimate is about 3 to 4 hours. So, kunyari, you get a package, you don't know if it's infected, you leave it, don't touch it. Leave it for about 3 to 4 hours. If you want, you can spray it. Pero sabi nila, in surfaces, hard surfaces, or yung mga hindi siya porous, within 3 to 4 hours, the surfaces usually dead na yung virus. They cannot actually survive on inanimate objects.
So
pero
siguro,
so
siguro dapat, no, dahil madalas tayo magpa-deliver ngayon, no? Siguro dapat kung may i-deliver, iwan muna dun sa isang table sa tabi ng pinto o dyan ka lang muna. Mga 3 to 4 hours ka muna dyan. Diba? Para sigurado.
Lalamig naman po yun.
Tama po yun?
Lalamig naman po yung pagkain. Lalamig ang pagkain nyo.
Kainin nyo na agad yung pagkain. Yung mga ibang bagay-bagay na pwede maghintay ng 3 at 4 hours, di ba?
Yes.
Para lang sigurado. Okay. Ngayon, para lang makahanda tayo sa COVID, sa tingin nyo, ano ba ang mga bagay at mga gamot na dapat nasa medical kit sa ating mga tahanan para ready lang tayo just in case biglang may magkasakit dyan?
Yeah, I prepared a slide for that kasi actually, we're not talking about ano naman, di ba? Specifically for COVID, just for any emergency. Okay, so, yan yung kailangan meron ka for kate, for sunburn, for diarrhea, for constipation, para sa masakit na tiyan, anti-allergy, cough and cold medication. So if someone in the house has anaphylaxis na history, so you can have an auto-injector of epinephrine, and all of these other things. Pero yun, mas better na, all of this naman kasi are mga over the counter. So you just prepare kasi mahirap nga to go out. But for taking care of someone with COVID, paracetamol, vitamin C, with or without the zinc, vitamin D, yan. It can help.
Or okay. Kunyari meron naman kayong inaalagaan na may COVID sa loob ng bahay, no? Ano kaya ang mga senyales para alam na natin na una po kailangan na natin itakbo ito sa ospital?
Opo. Ang pinakababantayan yung hirap sa paghinga. Hirap sa paghinga or kung nagbabago yung kulay, alam mo yung sinasabi nilang parang bluish. Pero if you wait for that, medyo late na. So, hirap sa paghinga, if you can get a pulse oximeter, pag yung oxygen is less than 92, so wag na tagalin. Unfortunately, ang nakikita nga namin ngayon in lung center, medyo when they go to the ER, severe na or grabe na, and syempre, it's harder to save someone who's in the severe to critical already, kaysa mas maaga kang magpapahatid sa hospital. I-evaluate naman kayo kung kailangan talagang ma-hospital or kung pwedeng pabalikin sa bahay.
Siguro mas magandang minomonitor rin sila sa umpisa pa lang may COVID sila. Dapat meron na silang kausap na healthcare provider, di ba? Nurse o yung birth ng barangay. Nakakatulong yan. Train rin yung mga yan para tumingin at least initially, no, kung walang makuha kaagad na healthcare provider. Malaking bagay yun. Dapat malaman nila yung BHERT, BHERT or the Barangay Health Emergency Response Team. Alamin niyo po yun sa barangay. Lahat ng barangay, alam ko, may ganon at train sila para tumulong sa kanila pag may COVID. Alam niyo kasi, ito nga, yung sunod na pag-usapan natin, yung myth and facts of COVID. Pero marami kasi pag may COVID, nagtatago na no? Parang ayaw nila magsabi na may COVID. On the contrary, dapat magsabi kayo sa barangay para tutulungan kayo pag kailangan nyo ng kahit anong kailangan nyo tulong. Diba? Mapunta tayo sa mga myth ng COVID. Ano sa tingin nyo tungkol dito, no? Yung isa, pagsusuob.
Pagsusuob, it's parang nag-inhale, inhalation. So, for ginagamit yan dati sa mga may cough and colds kasi it liquefies di ba, yung sipon, mas natutunaw. But it's not a cure for COVID. Pag masyadong na mainit yung steam, you can helpful in patients with COVID. So, hindi namin siya nire-recommend for our patients.
Okay.
Hindi pa. There's not enough.
Yung sabi nila na dapat parati ka nag-gargle at maglinis ng ilong ng mga gargle solutions.
Well, it seems like a intervention, di ba? Kasi sabi nga, the virus will stay or grow in the throat. And in some small studies, parang it decreases the viral load. It, again, is not a cure. It will not prevent you from getting COVID. But if you practice that, then it's just 1 point for oral hygiene. But it's not a cure. They're doing some studies, pero sa ngayon hindi pa siya proven to prevent COVID transmission or infection.
Okay, thank you for that. Yung iba na bili na raw kaagad ng mga oxygen tank sa bahay kasi nagkakaubusan na raw ng supply.
If you need oxygen, you actually need to be admitted. So hindi solution that you have oxygen in the house. If yung infection mo is bad enough na bababa yung oxygen mo and that you need oxygen supplementation, ibig sabihin you will qualify ngayon to some proven treatment for COVID, and it cannot be given at home. So hindi siya solution, but kailangan, if you're oxygen requiring already, that you should be in a hospital setting so that you can receive proper treatment for COVID.
Lalo na ang mahal ng mga oxygen ngayon, ha? Tumaas talaga.
Yes.
Kasi
The
kailangan
oxygen
supply
itself,
Demand,
it's not,
demand, sorry.
yes, opo.
Yeah, okay. Paano yung iba raw? Kailangan mag-order na o magtatabi na tayo ng ivermectin?
Ivermectin. This is very controversial even among the doctors. Kasi marami rin nagpa-publish actually ng mga studies, for example, that in this particular study, there seems to be efficacy. In this study, there's none. Pero what can be observed from all of this is, for all of the trials, so far, maliliit yung sample size. Hindi iba-iba yung doses na ginamit. Hindi randomized. Alam mo naman, Gigi, di ba? For a study to be considered strong evidence, it has to be randomized, blinded. Okay? So most of the studies hindi open label siya. Tapos may mga ibang confounding factors na nag-steroids din, nagbigay din ng antibiotics, nagbigay din ng iba. So hindi siya strong yung evidence for all of the studies so far for ivermectin. Well, we're not saying in the future there may be some stronger evidence for the use of ivermectin. But as of now, given the state of evidence available, hindi pa natin ma-recommend ang treatment for ivermectin. And that's from the mga scientists and our specialists ng infectious disease. Yun yung recommendation nila. In the future, why not? Pero sa ngayon, wala pang enough evidence for us to recommend it.
Yes. And siguro that's true sa management of COVID talaga. Kasi dapat ma-realize ng mga tao na bago ang COVID. No? Last year lang natin na nalaman itong COVID na ito. So, the management of COVID, yung mga dapat magamot, test and all, medyo linalearn pa ng ating health community yan, no? Kasi bago siya. Kaya wala pang mga randomized trial yan, but well, some doctors have their own way of managing, and that's okay because as we said, baka wala pang talagang standards of care ang COVID management kasi maraming types of management and it's changing, di ba? By the minute, maraming bagong dating na gamot or dapat ito gawin. That's because
there's a living document for COVID and a group of specialists. They reviewed all the data and they came up with a summary to guide all other medical practitioners on the management of COVID. But for mild COVID, yung mga pwedeng i-manage sa bahay, wala pa talagang antiviral or intervention that will cure it. So symptomatic lang talaga treatment for mild COVID.
Iwas talaga para hindi tayo mahawa sa COVID. Napakahirap po talaga na magkasakit ng COVID, lalo na kung yung mga moderate to severe or mga critical na kailangan ni hospital. Mamaya po meron tayong isang tao na nagsalita about his experience in COVID. So napakahirap po talaga. Doc, ito last na pong question ito, no? Meron pa rin tayo mga kababayan na ayaw magpabakuna. Ano kaya sa tingin nyo tungkol dito at ano maipapayo nyo sa kanila?
Yan. Ito kailangan ko mag-share. Kasi gusto kong ipaintindi kung ano ang kailangan natin from the vaccines. Yan, okay. Yan. Sorry. Is my screen showing already? Yeah.
Yan, okay.
Is it showing?
Yes,
okay.
Yes, it's showing.
Yeah. Okay. So, ang pinaka solusyon actually for any disease is if your body acquires resistance or immunity. Okay? So, ang magkakaroon tayo ng immunity or pwede natin immune na ako dyan or resistant na ako, hindi na ako magkakasakit. That's what you call immunity. And that, in effect, is if your body has antibodies to fight the infection. Okay? So you can get immunity either actively, ibig sabihin, kailangan ma-expose ka, kailangan magkasakit ka, pero hindi ka mamamatay. So you will get immunity. Or you can get a vaccine. So that's two ways. Natural immunity, if after an infection, your body develops antibodies. So the next time you're exposed, hindi ka natatablan. And the artificial are antibodies that's made after getting a vaccination. Yung passive immunity is, ito yung mga convalescent plasma. Yung kukuha sila ng antibodies in another person and then i-inject sa'yo. So that's artificial. And some antibodies that are passed on from mother to baby, that's a natural but passive immunity. Okay, so pag walang, kung ayaw mo magpabakuna at na-expose ka to someone with COVID, then you can get it. And you can transmit it to someone else, and that person can transmit it to someone else, and you will notice na maraming magkakaroon ng infection. Is that a problem? Eh kung hindi naman sila mamamatay sa infection, okay lang, di ba? They'll get natural immunity. Unfortunately, pag nahawaan ka ng COVID or nahawaan ang nanay mo ng COVID o yung anak mo ng COVID, walang makakapagsabi kung magiging mild lang yan or kung magiging severe. You can't say, di ba? But if the majority of the community has immunity from vaccination, kahit you have COVID, malabong may mahawa sa'yo ng ganito kabilis. Okay? So that is what vaccine is trying to achieve for all of us. We have to have 70% of the Filipino population with immunity. And that's the only time we can start living a normal life again without the mask, without the shield, going out on family outings, traveling abroad. That's the only time we can do that. If we don't achieve herd immunity, whatever it is we're going through right now, yun pa rin ang mangyayari. Okay? So ito is another illustration. Kung most of the population gets immunized, then the spread is contained. Pag hindi immunized ang majority of the population, eventually everybody will get infected. Okay? So this is what happens if there's immunization of majority of the population. And this is what happens when hindi lahat nagpapabakuna. So you owe it to your family, you owe it to the community, you owe it to the entire Philippine population to get out of the pandemic. And your contribution is you protect yourself. Because by protecting yourself, napoprotect mo rin yung pamilya mo at nakaka-contribute ka sa herd immunity. Okay, so there are several vaccines. Nagkakaiba lang sila in terms of overall efficacy, in terms of nakaka-prevent ba sila ng mild to severe disease. Pero regardless kung anong vaccine ang tatanggapin mo, all of them will protect you from severe disease or death. That's all we want. We want to survive this. If you get infected but you survive it, you get immunity, natural immunity. Diba? Pero if you don't get the vaccine and you get COVID, there's a chance that it might be fatal for you, or if not for you, for a family na unfortunately ikaw ang nagdala ng infection sa bahay. Ay, final message ko na daw. Should I go to my final message?
Sige, no, go. Sige.
Tuloy ko na para I can stop sharing.
Tuloy mo, oo.
Tuloy ko na. So simple lang ang message. Habang wala pang herd immunity, always wash your hands. Okay? Hindi yung ganun ha. You have to practice the wash your hands, happy birthday to you, di ba?
Nakala ko happy birthday.
Ganyan, 60 seconds. And reminder to everyone, yung paggamit ng alcohol gel, you also do that. Okay? 30 seconds. But you also do that. Okay? Avoid close contact. Ibig sabihin, when you're outside, maintain the distance. Keep your face masks on. Hindi yung paminsan-minsan, ay, nakamask ako. Tapos mamaya, ay, tatanggalin ko muna kasi iinom ako. Ay, susuot ko na naman. Ay, useless yon. If you're going out, put on your mask. Keep it on until you're out of the public. When you're alone again, that's the only time you remove it. Kaya nga ang
Inom
advice
ka na
natin,
bago ka lumabas, di ba? Inom ka na bago ka lumabas. Inom, tapos tigil ka sa inom ulit pagdating mo doon sa pupuntahan mo.
Basta not in transit, not in public, and don't do that yung ibababa mo na nandito yung mask sa ilalim. And when you cough, cover your cough, okay? And always disinfect and clean. And yung surfaces around you, you always clean that. Minsan kasi, like in a family, at home, pero lumalabas ka, and you might bring the virus home. So always, when you go out, keep the distance, wash your hands, wear a mask. So keep your safe bubble. And when you go home, then you're still safe. Okay? So keep the bubble, keep your home well ventilated. Okay, and I showed you na open doors, open windows, exhaust fans, air filters, and help us do your community of immunity, get the COVID vaccination. So it's the best way to protect yourself, your family, and your community. And to end COVID for the Philippines, it will start with you being willing to get vaccinated for ending this pandemic. Yun po ang aking final message.
Napakagandang discussion po nito, Doktora. No? Tandaan po natin ang sinabi ni Doktora, lahat po ng ginagawa natin, mass social distancing, and then vaccination, hindi lang para sa atin ito. Para sa pamilya mo, maprotektahan ng pamilya mo, ang community mo, at ang buong Pilipinas. Para po matigil na itong pandemic na to. Yan po ay napaka-importante kasi akala ng iba, sa kanila lang yun, protektahin ko sarili, hindi po. Kung mawalan na ng COVID, then the whole country will benefit from following all of this advice. No? Salamat, Doktora. Alam ko napaka-busy nyo dyan. So, napakalaking pasasalamat po namin ang PhilHealth na nag-guest kayo dito. Meron pa kayong parting message po sa ating mga nanonood?
I'm good na po. Nasabi na yung aking message. Salamat for inviting me.
Sa susunod po. Sige, salamat. Salamat, Doktora. Okay, bye.
Bye-bye po.
Okay. Mapunta naman tayo dito sa ating isang FB post ng isang na COVID po siya, si Mr. Alvin Santos. Papasalamat po kami kay Mr. Alvin Samson sa kanyang isinulat sa kanyang FB account noong April 16, 2021. At ito po yung post niya, kung papayagan nyo ay babasahin ko po. Gusto kong pasalamatan ang Philippine Health Insurance Corporation or PhilHealth. Nung makita ko na ang final bill kasi siya po ay na-ospital, malaking kaluwagan ng makumpirma kung naibigay sa akin ang pinakamataas na ayudang maaaring maibigay sa isang COVID-19 patient sa ilalim ng case-based payment ng PhilHealth benefits. Critical pneumonia po siya. Kasi critical pneumonia kasi ang aking case at 786,000 ang corresponding benefit na bigay ng PhilHealth. Kahit gaano pakalaki ang matitirang balanse, hindi tayo makakapulot ng 786,000 sa labas ng bahay natin. Maraming insurance companies o HMOs ang dapat mahiya dahil hindi nila ito kaya tumbasan o sabayan. Ang PhilHealth ay dumaranas ng matinding pagbabatikos. Madalas wala na sa katuwiran at pinipersonal ang matataas mong officials o mga rank and file na empleyado. Maging mga anak ng empleyado ay binubuli ng mga kaibigan nila. Most of the time, what I see in social media posts, even of some of my friends, are quite obviously filled with cognitive distortions, including generalization, confirmation bias, and a lot of discounting. PhilHealth employees are public health workers and are also serving in another frontline of this pandemic, that of providing universal healthcare benefits, mayaman ka man o hindi. Gaya natin, exposed din sila sa mga panganib ng pandemya at habang isinusulat ko ito, ay marami sa kanilang mga empleyado ang ginugupo ng COVID-19. Gaya natin, dumaraan din sila sa matinding mental at emotional stress habang iniisip din ang kaligtasan ng kanilang mga pamilya. So, dear PhilHealth, maraming salamat sa inyo. Know that there's a grateful nation, millions of families who depend on you and who benefit from your great service during this pandemic. My family and I have been comforted greatly by the universal healthcare benefits that you are championing, as well as the reforms that many of you are trying hard to push. I know that these reforms need to include hospitals, HMOs, and medical professionals too. Please keep on fighting for our families. Maraming nagmamahal sa inyo. Maraming salamat, Alvin. Ipinapanalangin namin ang inyong lubusan paggaling, Alvin. Salamat sa sinulat mo po. Kami po sa PhilHealth ay tuloy-tuloy magseserbisyo po sa mga kababayan natin through our benefits sa ospital, o may benefits rin kami na hindi kailangan ma-ospital ay magkakabenepisyo. Meron pang mga parating na benefits under this COVID, no? Abangan niyo po 'yon. Tuloy-tuloy po ang ating trabaho at ating serbisyo sa ating mga kasamahan po at kababayan. Salamat po. Salamat, Alvin, for that. Meron po tayo mga questions na sasagutin, no, bago tayo magtapos. Saang galing po kay Charles Mesinas, saang portal po ng PhilHealth pwede magbayad ng contribution? Kung kayo ay self-paying member po, kayo ang nagbabayad ng sarili nyong contribution, maaari po kayo magbayad sa ating PhilHealth online payment. No? Ngunit pag kailangan nyo mag-create ng inyong account sa PhilHealth member portal na ito, matatagpuan po itong portal na ito sa PhilHealth website, no? www.philhealth.gov.ph. Paalala din sa mga nagnanais na magbayad ng kanilang contribution online, kailangan updated ang inyong membership record, lalo na yung monthly income, upang makapag-generate kayo ng yung tinatawag na SPA or Statement of Premium Accounts. So, yun po ang sagot, Charles. Si Princess Charina Mendoza, ano ang kailangan para makapag-change ng address? Mali po kasi ang nalagay na address sa aking MDR or Member Data Record. Madali lang yan, Princess Charina. Para makapag-amend kayo ng iyong address, ang gagawin nyo po ay mag-download kayo ng form. Alam nyo, iisa lang ang form ng PhilHealth para mag-amend, para mag-apply. Isa lang yon. Ang tawag dyan ay PhilHealth Member Registration Form. Pwede po i-download ulit to sa ating website. Ulitin ko po, www.philhealth.gov.ph. Punan ang nasabing form at maaring ipadala sa pamagitan ng email sa actioncenter@philhealth.gov.ph. Okay? So, announcements. Yung mga kumakalat sa video, sa social media tungkol sa di umano'y upcasing ng mga confinement sa mga COVID-19 case, ito po ay iniimbestigahan po natin sa PhilHealth. Ngunit kailangan po natin ng kooperasyon ng lahat. Kung kayo ay may alam tungkol sa mga bagay na ito at mayroong matibay na ebidensya, ito ay magiging tulay upang magkaroon ng malakas na kaso laban sa mga nagsasamantala na ito. No? Kaya hinihikayat namin kayo na ipagbigay alam ninyo sa amin ang mga alam ninyong gumagawa nito. No? Paano po? Sa email, whistleblower@philhealth.gov.ph. Ito rin po, opceo@philhealth.gov.ph, at saka actioncenter@philhealth.gov.ph. Kung gusto nyo, mail. No? Ang aming opisina po ay nasa room 17. Nandito po kami sa City State Center. Pwede nyo ipadala sa room 1711, 17th floor, City State Center, 709 Shaw Boulevard, Pasig City. Meron tayong telepono po. Ito ay 84417442. Pero meron rin tayong callback. Kung hindi kayo makatawag dyan sa number na yan, ay mag-text kayo dito sa number na ito, 0921-630-009, at meron magko-callback, tatawag po sa inyo. Mag-iwan po kayo ng message. So kung kayo ay mga may katanungan o nais malaman pa kahit ano sa PhilHealth, pwede rin kayo mag-ugnay sa ganitong mga paraan. No? Nasabi ko na pa sa inyo yung Action Center, yung callback. Sa FB page po namin at PhilHealth Official, Twitter @Team PhilHealth, at email actioncenter@philhealth.gov.ph. So dito na po nagtatapos ang ating Alagang PhilHealth dito po sa FB Live. At sana po ay marami kayong natutunan dito sa ating session na ito tungkol sa COVID. Kung may katanungan po kayo ay doon po sa mga sinasabi kong mga platforms ay pwede kayo magtanong. So maraming salamat po sa lahat ng nanonood at nakasama natin sa araw na ito. Sana patuloy kayo makakaasa, ang PhilHealth ay kaagapay ninyo sa pangangailangan medikal. Dahil sa PhilHealth, kalusugan mo sigurado. Salamat po at keep safe po lahat.